A large study, which includes some of the most rigorous research to date on heart disease, is raising questions tonight about a procedure that millions of heart patients have undergone. But did they really need it? Meg Tirrell has the story.
For millions of people with a condition known as stable heart disease, the medical wisdom on treatment may be less is more. A landmark study released this weekend showed that routine intervention with stents or heart bypass surgery did about the same as drug therapy and good health habits alone in preventing events like heart attack. The results were presented at the American Heart Association's annual conference in Philadelphia. The trial included about 5,000 patients with stable heart disease, defined as those with blocked arteries that aren't causing an immediate issue, said Dr. Robert Ye, Associate Chief of Interventional Cardiology at Beth Israel Deaconess Medical Center.
These patients may have some chest discomfort when they go outside and walk up hills, when they shovel their snow, etc. But for the most part, this is a reliable symptom that happens when they exert themselves, gets better when they rest, for example.
For those patients, the trial results can help guide conversations with their doctors.
When one is told that they have a 60 or 70% blockage in their heart, they get concerned. They want that blockage to be addressed. They want it to go away. Part of our role as physicians is often to reassure those patients and say, you know, even though that 60% blockage is there or that 70% blockage is there, and yes, while I do have a therapy that I can give you that can make that reduce that blockage to zero, it's not actually going to change anything for you.
The trial did show that interventions like stents helped alleviate chest discomfort, known as angina, more than medicines alone. On Wall Street, investors closely watched the results to see their effects on shares of stent makers Boston Scientific, Medtronic, and Abbott Labs. It's a market Cowen analyst Dr. Josh Jennings says amounts to about $3 billion a year.
It's an overall positive relative to not facing the worst case scenario for all three players.
Some investors, he said, were concerned the study would show stents caused worse outcomes. Instead, there were situations where they showed a benefit.
The quality of life benefit in the stenting arm is the big positive, clearly, and I think that will continue to drive utilization in those stable angina patients that are symptomatic.
And doctors emphasize stents and other interventions still have an important role for many patients. Dr. Ye cautioned that patients experiencing chest pain that doesn't go away after a few minutes could be having a heart attack, and this study doesn't apply to them. For those with stable disease, it provides more information to guide treatment. For Nightly Business Report, I'm Meg Tirrell.